Seborrheic dermatitis. Seborrheic dermatitis is a common, chronic, or relapsing form of dermatitis that mainly affects the sebaceous gland-rich regions of the body, especially the scalp, face, and the trunk. There are infantile and adult forms of seborrheic dermatitis. The cause is unknown, as is the role of the sebaceous gland in the disease. Malassezia farfar is implicated as a causative agent, although it remains unclear whether the fungus itself, it is byproduct, or response to the fungus by the body causes this problem. Seborrheic dermatitis affects 3 to 12% of the population. Infantile seborrheic dermatitis affects babies under the age of 3 months and usually resolves by 6 to 12 months of age. Adult seborrheic dermatitis tends to begin in late adolescence. This form is more common in males than in females. Seborrheic dermatitis often occurs in otherwise healthy patients. When we see certain risk factors that are associated with severe adult seborrheic dermatitis, oily skin is one of them, familial tendency, immunocompromisation, such as retroviral infection, diabetes, malnutrition, neurological and psychiatric diseases, use of neuroleptic medications, treatment for psoriasis with ultraviolet therapy or psorialine. Lack of sleep and stressful events are also linked with this problem. Infantile seborrheic dermatitis, often called cradle cap, which is a diffuse greasy scaling on the scalp. The rash may spread to affect armpit and the groin folds. There are salmon pink patches that may flake or peel. It is not especially itchy, so the baby often appears undisturbed by the rash even when generalized. When we came to adult type, seborrheic dermatitis commonly affect areas of the skin with high sebum production, as we have said. So patches of greasy skin covered with flaky white or yellow scales or crust in the scalp, face, side of the nose, eyebrows, ear eyelids, chest, groin area, or under the breast. The diagnosis of seborrheic dermatitis is clinical, based on the location, appearance, and the behavior of the lesion. But if we want to confirm, we can do a biopsy. General measures for treatment include educating the patient about the skin condition and the appropriate skincare routine, identifying modifiable lifestyle factors such as, for example, stress and the lack of sleep are associated with flare-up, so modifying those things, and also high fruit intake is associated with less seborrheic dermatitis. So taking high fruit and decreasing stress and having adequate sleep decreases this problem, especially the flare-up. Specific measures include a combination of different management approaches. The first is keratolytic. This is used to remove scale when necessary, such as salicylic acid, lactic acid, urea, and others. Topical antifungal agents are applied to reduce malassezia, and mild topical corticosteroids for 1 to 3 weeks to reduce the inflammation of an acute flare. Tacrolimus ointment or other topical calcineurin inhibitors are indicated if topical corticosteroids are needed to be used frequently, because those things, calcineurin inhibitors have fewer adverse effects on the facial skin with long-term use compared to steroids. Management in infants include regular washing of the scalp with baby shampoo, followed by gentle brushing to clear the scalp. White petrolatum might be also used, and topical antifungal agents are often prescribed depending on the extent of the rash. Overall, while seborrheic dermatitis may be self-limiting, it may take a long period of time to resolve. Cradle cap in infants usually take a few months to up to 1 year to disappear, and in adults the condition is frequently chronic and a long-term maintenance treatment is often necessary. Thank you for watching.